Hey, let's do a chemical peel. It's been a hard work week. And this is me, no makeup. Boy, a chemical peel will do wonders. So we're going to use the PCA brand, and I have got to figure out how to not do this backwards, but this is the PCA Skin Sensi Peel for sensitive skin. I'm very fair-skinned. I tend to get red pretty quick. The ingredients on this Sensi Peel and why I like the PCA skin products are they use a lot of natural ingredients. So the main ones, lactic acid, and of course the TCA acid peel ingredients. It also has a little witch hazel, glycerin, citrus, lemon peel extract. There's hyaluronic acid and Emblica officinalis fruit extract. Okay, we're gonna start. So the first thing you do is we start out with very clean skin, no makeup. That's what I've got going on. And not that you're gonna, I don't recommend this doing at home. I do this in my clinic with patients. It's really great for treating actinic keratosis, which are, the little crusty sunspots you can get that sometimes they're benign, but if left untreated over 10 years, they could turn into squamous cell carcinoma. So you do want to get rid of your little actinic keratosis or those scaly, dry little sunspots. And when you do chemical peels, at least once a month, if you're worried about sun damage and skin damage, you can lessen your chances of benign lesions progressing into cancerous lesions. And remember, anytime, well, not that you need to remember this, but anytime you have a lesion that crusts or bleeds, that's not a good sign, and you want to have that seen by your primary care doctor or your dermatologist. I understand that chemical peels also can lessen the risks of more severe basal cell carcinomas. I'm not saying it treats cancer, but it just lessens severity if there is one and it hasn't been detected yet, but you're doing regular chemical peels. Again, it just helps slough off lesions that shouldn't be there. It also helps fine lines, skin discoloration. I was in the sun a lot, and I have a lot of freckles, and any little brown spots that I have become darker. So we're going to start. So we have clean skin. We have the solution ready to go, and you have your brush, and you start applying. Whoop. It's very liquidy, so I gotta go kind of fast. It has a really strong smell. Keep it away from your eyes. And woo, that is strong smelling. So maybe while I'm doing this, we can talk a little bit more about really what kind of doctor I am. So interesting to note, I started off as an RN, and I still work as an RN and hold my RN license. And so as I began as a nurse, I've worked in the hospital, med-surg, and then eventually just became a float nurse where I worked everything from telemetry, cardiology, OBGYN, it's strong, and all over the hospital. And then after years of the hospital, I became interested in hospice. So then I became a hospice nurse and did that for many years. And I think I'll do some videos on my experience as being a hospice nurse and the privilege I had working with patients and families entering the phase of death and dying. And it's really fascinating. And I also saw some amazing things which did confirm and solidify my faith in God and my faith in a spirit, and that we all have a soul. Because, and I'll do some separate videos on that, because having faith is one thing, and sometimes when you have faith, you just know in your heart it's a thing. But when you see things yourself as a witness, that pretty much solidifies it, and there's no second guessing anymore. So those of us that work in hospice, which I did for 10 years, Most of us have seen some stuff, so we'll go into that. Okay, we've done the first layer. It's quite tingly right now. Woo-hoo. And we'll just let that fan and set for a second. So after 10 years of hospice nursing, became interested in working in school nursing, which is what I still do. So when I talk about my other full-time job, I'm going to post a video of the school clinic that I just helped set up, so it's ready to go, which I think is really inspirational for any nurses think about getting into school nursing. It is so fun, and again, it's an honor and a blessing and a gift to be able to work with children and kids, because you can't help but have a good day. It's a hard day, but you can't help but have a good day when you work with children. And then my years of doing that, we had a free medical clinic for our students and families that had low income. And we had a group of doctors that would come and treat them for free. And they were doing things I had never seen in the hospital. Instead of ordering an antibiotic right away for an ear infection, they were changing their diet. They were talking to them about nutrition and getting rid of sugar and junk food, and offering education on certain nutrition and supplements. And it was fascinating. And I said, well, what kind of doctors are you? And they said, well, we're naturopathic doctors. And I'm like, what's a naturopath? I had no idea what one was. I had never heard of a naturopathic doctor. Well, long story short, at the time, there was 4 naturopathic schools in the country. And one of them was in the state that I live in. And long story short, I quit my job at the end of the school year, had to go back to college to get new prerequisites, because you did have to take physics and upper level organic chemistry. And so there was more prereqs involved than it was for nursing school. So I did go back, took some more college courses, and then went to naturopathic medical school, which was a 4-year program. And then my internships were at an urgent care in town. And then I also ended up working and getting hired at an endocrinology practice. So fast forward to today, I now have my own private practice. I mostly see adults. Every now and then I'll see a teenager. And my focus is on family medicine, but I do tend to do more treatment with diabetics and thyroid and more endocrine issues, hormones, etc. And so that's a little bit about, okay, we're going to do the second pass on the chemical peel. So that's a little bit more about me and what kind of practitioner I am. And so the kind of great thing is I kind of still have a foot in both worlds, because I still work as a full-time RN, but then I also have my private practice. And I see my patients when I get home in the afternoons until the evening on the weeknights, and then I see patients on the weekends as well. And then also do telemedicine and phone consults. My mother says I'm a workaholic, and I've always been like that. Ever since, as soon as I turned 16 and it was legal to work, I had a job. And so to me, I really enjoy working a lot, and it's very doable. It's a doable thing. Okay, so we're really tingling now. PCA recommends that you do 3 passes. I'm at the second pass right now. It's pretty tingly, getting a little bit pink, but I'm going to concentrate on the spots that really need to peel off. Just some of these darker freckles from the sun damage. We're just going to really hit those for a 3rd pass, because we want those gone. And then in my videos after this, we'll be able to kind of critique and see how this peel worked. Because I challenged myself to do post at least, if not more, 1 video a day for 30 days. Because remember, it takes 30 days to form a habit. So I have 30 days to form this habit, and then I hope after that, posting a video a day will just be like brushing my teeth. I really enjoy doing this because I'm not trying to put pressure on myself to do a lot of editing. I mean, hopefully over time I'll get better at posting this, but for now, I'm just okay with this. Get that area under there. Whew. Okay, it is tingling up. So if anybody's watching this video and you want me to talk more about how did I start my private practice, which is kind of interesting, and I have to say I did have a moment of panic where I did call a colleague who was already in business and had a really successful practice, and I panicked and I said, oh my God, I don't know if I've done the right thing. How am I going to start a business? No one's going to ever come see me. Like, nobody knows who I am. And now, over 10 years in practice, I have seen hundreds and hundreds and hundreds of patients, and I have a full practice now where if someone does need help, and if they're already an existing patient, like a friend or a family member, I'll still see them. But my practice is full, and I'm happy with the amount of patients I have now. And so it's kind of like building a YouTube channel. You start with 0 views and no one's really watching, and you're wondering how's it going to happen. But I remember then when I started the first day, sitting in my office with, my sign up and furniture in and computer ready to go, and just like, how are people going to know to walk in the door? How am I going to do this? To now where it's like, it's consistency. Even though I had no patient schedule that day, I would still go to the office and stay in the office. But I did work on a marketing strategy, because when you're a naturopathic doctor, at least in the state where I practice, you can take insurance, but I did not want to take insurance. I wanted to have a pay-as-you-go, affordable practice where people did not have to use insurance, and that afforded me more time to be with my family, and it's very doable to do that. And sometimes I'm going to do a little bit here too, because there's a lot of sun damage. Sometimes I'll get on websites and other doctors are just talking about how much time they spend charting now in the hospital, and all the primary care doctor shortage we have, because it's hard. And I remember at the endocrinology group that I worked at, I was spending way too much talking to patients and explaining things. And I remember the physician, the owner of the practice, told me, I'm going to start putting a timer in your room because you are spending way too much time with patients, and I really need you in and out of that room within 8 minutes. And I was like, thinking to myself, there is no way I could work like this. I mean, that's seeing more than 30 patients a day, and I couldn't remember and keep things straight, who I saw that day. I really like being in control of my life and spending as much time with patients as I want. And for me, yes, it's important that we make an income that we can pay our bills with, but my goal is, my goal was not to become wealthy doing this. I mean, usually most people in medicine get into it because they have a calling. And anyway, I can have another video that talks more about that. So I think we're done applying everything. It gets a little shiny and tight. And I think that's all we're going to put in. So thank you for staying through this video. And as the days progress, we'll see how this turns out, because I will be putting out another video tomorrow sticking to the 30-day challenge. Thanks for watching.